Have you been wondering about how to help your cancer patients deal with treatment side effects, including endocrine diseases? Listen in to today's special episode.
Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle.
Hello, and welcome to another episode of The Physician's Guide to Doctoring. I am your guest host, Dr. Amna Shabbir, and today we're going to be talking about cancer care. Our guest host is Dr. Shariff. Dr. Afreen Shariff is an endocrinologist with expertise in endocrine disease in cancer patients. She's a transformational thought leader in the field of endo-oncology and has led and started several successful national and international programs. She is the founding director of the award-winning Duke Endo-Oncology program and an associate director for the Cancer Therapy Toxicity program at the Duke Center for Cancer Immunotherapy. Outside of Duke, she serves on the board of the Association of Cancer Care Centers, on the steering committee for the Endocrinology Special Interest Group at the Endocrine Society, co-leads the International Alliance for Support and Prevention of Immune-Related Events, ASPIRE, produces and hosts a medical podcast series, Checkpoint Now, that is played in more than 50 countries, and is the co-founder for the virtual side effect management platform, Citrus Oncology. So with all that, welcome to the show, Dr. Shariff. How are you?
Thank you, Dr. Shabbir, for inviting me on the podcast. Absolute pleasure to be here for two reasons. Number one, I love your work, and I'm a great admirer of the content that you create to help everyone. So I am certainly honored to be here today.
Thank you. I'm so glad and flattered to hear that. So this is such a wonderful portfolio, and believe me, I had to leave out a lot of things on your bio as I'm sharing the work that you're doing and you're very passionate about. Can you share with us what attracted you to cancer care and what led you to your journey?
Wow, that's a loaded question. I can talk volumes about this, but I'm going to try to be as succinct as I possibly can. But I started doing this back in 2015, 2014. I was a young fellow back then, and that was my first week on consults, and I encountered my first patient with something called checkpoint inhibitor induced adrenal insufficiency. I'd never heard of these drugs. So I was busy like on Google and trying to figure out up to date, okay, what are these drugs? I've never heard them before. And I really love the science behind this because it made sense that you have these drugs that really enhance the immune system to target and kill cells that have evaded the immune system and now are transformed into cancer cells, right? So it made a lot of sense from the geek inside me, the nerd inside me, right? I love the science. And then I also understood that, these diseases that impact the endocrine system as a result of side effects, they are traditional diseases that we know, adrenal insufficiency, type 1 diabetes, but they're so nuanced. They're so different, right? Because you're dealing with a very complex patient population and the diseases occur abruptly. You're seeing them happen right in front of you. And at that point, I realized, this train is leading somewhere. And either I'm on it or I'm not on it, right? Because there was no one in this world at those times, very few people who really understood that there needs to be specialists that live in between oncology and endocrinology or oncology and rheumatology, all of these kind of spaces where they can fit that bill, where they have a good understanding of endocrine disease, good understanding and keep up with the cancer therapies and the newer developments, right? It's a big space. It's a very fast moving space and can actually help the person sitting in front of them. So that's kind of how I decided that, this is something I want to spend my entire life doing. And I love cancer patients. Those with cancer, they're just the most kindest, humble, and the most beautiful people to take care of. So I enjoy my work. I wake up every morning and I'm excited to get to work.
Wow. So you noticed that there was a clear gap in care and you were driven and drawn to it. That's where you found yourself. And then subsequently, you started on this journey of a very unique space. Like, when we talk about endo-oncology, and I'm looking back at your bio as I'm looking at it, your expertise is endocrine diseases in cancer patients. I mean, when I practice as a primary care physician, that really was not front and center to a lot. I mean, I would refer the patients out, but a lot of us are not thinking. What are some of the common mistakes that you think, or I wouldn't even want to call them mistakes, but things we are not thinking about as physicians, as surgeons, when it comes to endocrine diseases and cancer patients and how all of this is linking I'm trying not to mix up my words here.
No, this is a great question. And I think
Mm.
I agree with you. I don't think there are mistakes by any means. It's this, you just don't know what you don't know, right? And with the overlap with endocrinology and cancer biology and just cancer patients in general, right? It is such a strong intertwined relationship that we have, where I think of endocrinology as an amoeba that basically fits into the nooks and crannies of cancer care, right? Whether it is obesity associated tumors, where you want to treat metabolic disease, you want to treat type 2 diabetes for preventing patients from progressing into cancer. There's a strong link with that. So you can start from the, I would say, pre-viral care
Hmm.
to incident disease, where endocrinopathies or endocrine toxicities are so common. Childhood cancer survivors, 50% of them, if they live long enough, and they are living long enough now, right? We've
Yeah.
done such a fantastic job with cancer treatments that we are seeing a new problem in oncology. Patients are not dying from cancer. They're living, they're thriving. And now we're in this box where we're like, well, this is a new world. People are living long with after their cancer treatment, and they're living with side effects. Who's going to manage these side effects, right? So you have the pre-viral care, you have active therapy and incident side effects, and then you have survivorship, right? Patients who receive long-term steroids, for example. What are the long-term implications of this on the bone, on diabetes health, on metabolic health, cardiovascular health? There's so much overlap with that. And people are we're starting to see that the cancer is not taking them down, but it's the consequences from their treatments that is affecting them in the long term. So these are real issues. And I don't think that since I educate a lot of people in this endo-oncology space, I realize that there is a need to just kind of to redirect and steer that discussion, or steer your mind to think that, okay, what else do I need to worry about in this patient, right? They have a family history of four cancers, their BMI is 45 or 42. Should I be using GLP-1 RAs to help them lose weight? Because it helps with preventing them from getting into that cancer diagnosis, right? So these are the things that people just need to redirect. They already have the knowledge. It's about thinking through the lens of, okay, what can I do to prevent? What can I do to protect? When do I refer this patient out to that extra expertise, right? How do I manage intermittent steroids? It's a problem. And there is a nuanced way of managing that. You just don't throw in a stable dose of insulin and let them go home. They're going to have hypoglycemia, or they're going to be hyperglycemic. So you really need to understand that you need to match their steroids to their insulin doses. So it's a more nuanced approach to this. So I think people just don't know what they don't know. And understanding and obviously having podcasts like this really opens their mind to the idea that there are people who can manage side effects. There are people who specialize in this. Should we be thinking about sending our patient over there?
As you speak, I'm thinking about the time when I was practicing primary care, and it's busy. The time is limited, and the amount of issues that we address is also vast. And in that busy practice, somebody walks in the door. There's a very high likelihood when we're going through 10 different problems that this might get missed. And then sometimes you're literally screaming for help and you don't know where to seek help. Like, who is the right person to refer to? Where should the next step go? So, for example, since we're talking about primary care, somebody walks in the door, there is cancer history, there are other comorbid conditions. If we were to just take the outpatient case, how would you recommend physicians approach this scenario for those who are practicing in the outpatient care? And then who do we refer to?
That's a great question. It is a gap in care right now, and we're starting to see another specialty within primary care that's growing right now, which is primary care, right? Where these are primary care doctors who basically take on once a patient is discharged, I would say, from the cancer doctors, from the oncology team, they need to land somewhere, right? They need to go back, and they're living in this bubble of oncology care for 4 years or 5 years where their oncologists are their primary care doctors, right? They're doing everything. And now suddenly, it's kind of like a cord is cut. And this is what patients say. I don't know where to go. I've been taken care of so closely every 3 weeks, every 4 weeks. And now suddenly my oncologist says, I don't need to come to see them, which is a good problem to have. But then it also opens up another problem. Who do I find as primary care, right? So there's another specialty, and it's a growing specialty, just like endo-oncology, rheumong, dermong. I feel like this is a great time in medicine where we're all working together so well. I've never seen this happen. I've been in this profession for 22 years, and I've never seen so many specialists sit down and work on one patient and trying to improve the quality of life. So one thing would be, do you have the knowledge to manage this patient? I think you want to ask yourself. I think it's important in medicine to know what you know, and more important, know what you don't know, right? And it's always very humbling. There's so many things I learn every day where I learn, oh my gosh, I never knew about this. And this is amazing. That's what keeps us so excited about medicine, is that there's so much more. You're never going to ever know everything about everything, right? So I think it's important to know, do I know enough about the drugs of their patients? I think the first question you want to ask is, what was your cancer? What was your treatment? Who was your oncologist? Can I get some records from this? And the next question is, do you want to be the person handling this case? Do you know enough about these so that you're able to manage this patient? Do you need an oncoprimary care doc where you want to transfer the care out to this patient? And then if you have identified a particular problem, let's say it's an endocrine problem or a rheumatology problem, is your phone a friend rheumatologist or your endocrinologist the right person to manage this patient, right? Are they seeing just run of the mill cases, or are they working with a large cancer center, to have enough experience to manage these cases? So I think these are the kind of questions you want to ask yourself. Again, it is not meant to be punitive by any way that you don't know enough. It's just meant to be like, am I putting the patient where they need to be, right? And putting them in the right bucket of care where they're going to get exactly what they want. And I think what you would, this is a problem in endocrinology as well, right? There's a problem with every specialty. And more recently, this was the idea of why I started Citrus Oncology, because the access to people like this is so limited, right? I know all the people in the side effect world, majority of them by their first name. That's a problem, right? Because there's not a lot of people who do this.
Right.
So, how do we take the talent all across the country and make them think like specialists, right? Toxicity specialists or endo-oncologists or rheum oncologists. So that was the idea, to kind of decentralize or democratize side effect management in this country. And Citrus Oncology is a multi specialty virtual platform that provides cancer supportive care, which means that if you have a patient who is a cancer patient, whether it is a previvor, active therapy, or a survivor, and now they need a endo-oncologist because they need to manage their diabetes, you just can go on the website and refer patients to us. We can do an MD to MD consult for you, and we can also do direct care. So it's not just we want to pass on the buck to you and be like, oh, take care of this problem and these are our recommendations. We are comfortable just managing the patient on our own, and we bill insurance for that. So we really like to keep the pricing and the cost for patients very minimal, because financial toxicity is a big thing in the cancer space. People lose their houses, people lose their jobs because of this. So we really don't want to add the burden. So we've tried to bridge that real like wide gap of access and who should see these patients through Citrus Oncology. And we just launched a few months ago, and we're active in the state of Florida right now.
Wow. There's a lot to unpack in what you just shared. So, first of all, I think I want to underscore the importance of us knowing what we know and not knowing what we don't know, and that being okay. Kind of going back to that initial point, because there's so much shame and perfectionism that's attached to when we're practicing medicine as we graduate. And for everyone who's a generalist, especially, you're never going to know everything, but you need to know who is your phone a friend, who is that person, who is the resource. And let's just normalize that. I wanted to treat everything for everyone, but of course, I knew when to send my patients out. It's really critical to know that and be okay with doing that. And then, how can help be seamless? How can it be easy? How can that transition between what you want your patient to get, which is always the best possible care, and you also to have your own well-being and wellness, and that involves all these. I mean, I'm just trying to picture myself back in the room where it's so busy and I am seeing patients, I am doing notes, I am answering all these other things. And now I have to figure out what to do with this patient of mine who's having side effects, is on steroids, insulin, and management is all complicated. And there are other things I'm very much aware that I'm not aware of. And so, would it not be wonderful for everything to all be consolidated in one place where I can just tell my patient, use this website, please, you will get help, or use this platform, you will get help? I mean, that really sounds wonderful to me.
Well, that's amazing. And we actually accept consults from physicians as well. So you just send in a referral, just like you would send in to any endocrinologist or any rheumatologist or any cardiologist. You'd send in a referral to Citrus Oncology, and we will take it from there. We get the patient in on a virtual visit. We just exactly do what we can do. And the capabilities of the platform, we are highly specialized in just cancer side effects, right? So it makes it very I would say, very structured, our approach, and very cohesive across the platform. For example, if you're taking care of multiple different diseases, multiple different things, right? It's very hard to have a very streamlined approach to managing cases. So the way we've designed the platform is that any endocrinologist on our platform who engages with us and enrolls themselves on our platform, they actually have access to our proprietary system, which is designed by me. And likewise, we have other thought leaders and people who've developed the guidelines, et cetera, who have developed the platform in a way that it enables them to think like a side effect specialist. So that's how we scale the minds of a few thought leaders to the entire platform. So it is something we've created for Citrus, which is very proprietary. It's very unique. That's what solves the issue of scalability because we have fewer experts in how do we deliver the care across the country, right? This is how we think of delivering the care. And then we use a backend of AI and intelligence where we are learning disease patterns, recommendation patterns. We're learning about patient phenotypes and clinical, phenotypes of those patients because we get in very structured information, structured recommendations. So now we're able to scale and make our system very efficient because of the intelligence we've gained. So we're a service company in the front and the back end is AI driven. Or we use AI to improve our process and patient experience and provider. I don't like the word provider, so I'm going to say clinician experience. So that's how we've designed the platform to meet these several gaps, right? Gaps in service, gaps in access, gaps in expertise, and gaps in insight as well. Because we all know EHR is a bunch of garbage information that goes in the system. And it takes a mammoth act to clean that EHR data and make it information, useful information. So whoever's worked on the back end of EHR would absolutely relate to what I said.
There definitely is node bloat and when you're trying to find something worth value. So as you share this multiple approach that this platform offers, and as we think about cancer survivorship, adverse effects in patients, it sounds like pretty much any and everyone, whether it be a patient or a physician, can get help. Like you will find a person who will be able to connect with you and help you as you scale this and reach out to other people. So it sounds like a very good solution to a very gaping problem that we're not thinking about. So if I right now go on the website, I'm just going to be able to connect with somebody. What's going to happen?
Yeah. So when you go on the website, what you would do is you would put in a referral, which comes as an e-fax to us.
Okay.
And we connect with the patient. It's all HIPAA compliant platform. So we connect with the patient and the patient makes a patient profile where they add their medical information and we gather medical information through the EHR and through whichever practice we're working with. Some of them are paper faxes, right? So we get that information, but we get very structured information. We get problem specific information that helps our physicians on the other side review the case in great detail, but very specific. You're not sifting through a gazillion pieces of paper. You're actually looking at the problem on hand. So, for
Mhm.
example, someone is referred for adrenal insufficiency. We will have cortisols, ACTH, if they've been done, right? Recent history of steroids, medication usage. So our intake specialists know exactly what to collect for the problem. So it saves us time and there's no garbage going into our system. And then when we review the case, if it's an MD to MD consult, for example, we review the case and our target timeline is getting those recommendations back to you in 48 hours. So you get written recommendations to say that, Dr. Shabbir, we reviewed your patient's case and I would recommend that you should start this patient, get an 8 a.m. cortisol, for example, get an 8 a.m. ACTH. If it is less than X, I would recommend starting the patient on hydrocortisone 20 at 8 o'clock in the morning and 10 in the afternoon. And then this is the instructions for doing the emergency shot. And here's the instructions to give the patient for adrenal insufficiency. And we would like to see this patient. Can you please place a referral to Citrus Oncology? And then you place a referral to us and we do direct patient care. We will see the patient virtually, just like you and I are having a conversation. We educate the patient. We prescribe medications. It's basically just like a virtual visit. And the reason we've chosen certain specialties to start off with, again, we're probably going to go into deeper other specialties as well. We've chosen specialties which are I would say, well positioned for virtual care, like endocrinology, nephrology, rheumatology, cardiology, dermatology, right? A lot of this can be delivered through virtual care. And when we can't do it, when we really need to examine that patient, what we would recommend doing is to get the patient to be referred to a local dermatologist. But we will still give you recommendations to bridge that time Because you know what? The access to try to get into an endocrinologist is 70 days right now, and longer for a dermatologist. On average, it takes 30 days for any patient to get in. Your cancer patient can't wait that long. They're going to go through side effects. They're going to get into the hospital. So you don't have the luxury like other patients do. You're going to get tons of calls in between while the patient waits, right? Because they're knocking on your door and saying, I'm tired, I'm losing weight, I'm fatigued. Can you help me out, Dr. Shabbir? And it is a lot of burnout that oncologists are experiencing managing these side effects. So it's kind of a multi-pronged approach to solving a really critical problem and a gap in oncology care.
And kudos to you for creating this. And I mean, thinking of other things, it's incredibly cost saving. We're preventing ER visits, we are preventing unnecessary hospitalizations. And there is a very strong moral case for it, I would say, because that cancer diagnosis to begin with is so difficult, so challenging. And then not having clarity with what the next steps are, what's going to happen, that just makes everything even more complex and confusing. So, thank you for sharing that, Afreen. And as you step back and look at how cancer care and survivorship and side effects of treatment are dealt with, what are some things you want to leave our listeners with today if you were to say, I wish all physicians knew these three things? What would they be?
Wow, that's the big question. Let me think about it for a second. Now, I can tell you, I've worked with oncologists most of my career, right? I've kind of, and they're my best buddies. I know more oncologists than I actually know endocrinologists, which is not surprising. But I've had enough time to kind of parse through why certain things are not addressed, right? They're trying to do their best job. And all primary care doctors, all physicians, we have come into this business of medicine, or the art of medicine is what I call it, with a mission to help people. And they're always trying to do that. But as you mentioned, time is of essence. You have four patients waiting. You really want to address that blood sugar of 250 or 500, but you really don't have the time. So I think time is of essence. And, that is the biggest roadblock that most people encounter. So I think vigilance is important. And I like to put patients in two buckets when they come to see me. What's going to kill them and what's going to make them very uncomfortable,
Okay.
right? Which helps me understand the acuity of the problem. Where is it that I need to pick up the call and take care of this? And where is it that I can simmer the problem down so someone can take care of it, right? So I think that's kind of the bucket that most primary care doctors are. So if I had to say three things, number one, acknowledge the patient's concerns. They're coming in the door because they're not feeling well. I think validating their concerns is very important. Whether or not you're the right person to take care of it is a different question. But I think addressing the elephant in the room and saying that I understand that you're going through a lot, right? And cancer patients are going through a lot. But I'm going to do my best to see what I can do. And if I can't do it, I'll find you the right person who can do it. I think having that kind of conversation builds confidence, comforts the patient, really helps them understand the perspective that you're coming from, and also humbles down that conversation, right? Like we were talking about, we are Wonder Women, we are Supermans, we're all of this, but we still can't do certain things, right? So I think it's important to communicate that to patients, and they're very understanding and respectful of that. So I think that's number one. Two is that having your referral net or your safety net, whether it's Citrus Oncology, whether it's your phone a friend, having those connections, having that network is so critical. And having a mutually beneficial, like I help you, you help me, all relationships, whether it is working relationships or friendships, they are built off of that. And I think it's important to maintain those kind of relationships with your network. And then obviously attending CMEs, trying to understand what is it that you don't know, right? The beauty of cancer care is you can touch every specialty of medicine, right? And we are all like, we're seeing that patients are getting younger when they're getting diagnosed with cancer, and they're living longer. So if you don't see this as a problem today in your specialty, you will see this. And you will see more and more patients coming in your door with some diagnosis of cancer. And it's going to force you to learn about these things. So I think attending CME is making sure that you're keeping up to date and abreast with this growing evidence of, data that's around cancer care. It should kind of make folks well positioned to tackle the future of where cancer care is moving.
Recognize that there's something different, learn that you don't have to do this all alone, and reach out and network, ask for help. If I was to summarize in like three words what you shared, which was wonderful. And I think that it comes to communication again. As a patient, when I was on the other side of the exam table, it was so challenging when things were said to me, and more to come on that story later on. But it was not a good diagnosis that I got, and I was expecting my daughter at that time. And I was a physician, and another physician was counseling me. And I just did not register what he was saying in that stress.
Yeah,
So
I hear
clear
you.
communication absolutely is needed. And we don't have to do this alone. There are resources out there. You can reach out to your colleagues. And of course, as is the excitement and sometimes annoyance with medicine, there are things that are changing every day. So we have to keep up some sort of system that will allow you to learn and continue. Personal development and growth is so much needed. Thank you for sharing that.
Well, I couldn't agree more. And I'm going to put in a shameless plug for if people are looking for resources to learn. I think, not Citrus, I'm going to talk about Checkpoint now because that's the podcast that I've been hosting since about 2020. It was really created in the mission of educating clinicians and patients. So we have 2 seasons. Season 1 is directed towards clinicians. So if you are interested in learning about GI toxicities, neurotoxicities, nephrotoxicities, derm toxicities, ER, what are the reasons people go to the ER, endocrine toxicities, obviously, there is season 1. And if you want to share with your patients, because like you said, when patients come in and they hear the C word, they're very anxious, right? And I see them on the other side. I see them on the aftermath of the problem. So they're even more, there's a lot of white noise around them about the stress and anxiety. So they're really not processing everything, right? So what I usually do is I talk to them in clinic. I give them reading information. People learn very differently. So you have to accommodate for those things. And then I share videos with them and I share the podcast episodes with them. So we have patient facing podcasts. So if you have a patient with adrenal insufficiency, you tell them go to season 2, Checkpoint now, this particular episode. And I tell them, listen to it on the drive back. And then it'll help you understand and process the information I gave you in clinic. And that tends to layer on the learning because most people tend to absorb about 40%. And if you have a lot going on, you're probably processing 30% during that visit. So you really want to make sure you have multiple layers of information you're giving the patient and explain to them that you're not going to remember everything and it's okay. Because I think people also get stressed out in a visit because I'm like, I'm not going to give you a test at the end of this, right? And I'm going to give you an exam that you have to answer all the questions. I know you're not going to follow everything. And this is why you have this additional piece of information. And once you go home, sit with your family, grab a cup of coffee or wine, whatever people want to do to relax, right? And then just listen to it, right? And absorb this information. I think having that empathy especially towards cancer patients, it really draws them in to their diagnosis and draws them into having a better understanding for themselves and gives them closure. I think that's so, so important.
Beautifully articulated and what a wonderful resource to have that freestanding. It's right there. Anybody can access it at any point. Thank you for sharing that because I love podcasts and I'm thinking back to the time where I think that would have been very helpful for me if somebody had, a resource like that. I will definitely link to the resources for the podcast Checkpoint Now, as well as for Citrus Oncology for whoever is interested. Thank you again so much for your time today. This was wonderful, Dr. Sharif.
Thank you, Dr. Shabbir, for inviting me on the podcast. Certainly an honor. And I am looking forward to grabbing some coffee with you later on.
Looking forward.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.